Hi, for our project, we decided to pick the topic of global health, and the question we will be responding to is, what was the social response to the stay-at-home orders and/or the mask mandates? And those presenting in this presentation is Jose, Halima, Heavy, and myself, Marla.
Here from Chile. One of the most important measures is the mobility pass after getting vaccinated. This is used to enter certain public places, such as the cinema or restaurants. In addition, it serves to increase the amount of people that can be in some place. The other main measure is the step-by-step plan. It consists on changing the amount of days of the week that you can go out of your home and the amount of people that can be in the same place depending on the city where you are. The different cities change phases depending on the amount of infected people. Last but not least, talking about the mask mandate, the use of a mask is mandatory through the country to be in public spaces. Since the start of COVID, who does not use it can be fined. The government recommends clinical masks, but you can use anyone you want.
There isn't a lot of people during the lockdown. As for wearing mask, the most of the people did not mind to wear it. So for fear of the health of people who suffer from respiratory problems, which can be more serious due to the mask use, the state limits only one healthy person to go out of the house to meet their basic needs, from 9 a.m. to 5 p.m. Besides that, they appointed people to monitor citizens to avoid violating the condition of the lockdown. As you see over here in the screen, the policeman asked the people to show them the permission to go out in order to avoid all of the other problems.
For the United States, when states were starting to implement their stay-at-home order, there was a lot of uncertainty of what these orders meant and the duration of them. Living in such a fast-paced environment, being told to stay at home as much as you can and to only go out when it was really necessary was a drastic shift to people's everyday lives and also proved to be difficult for many. As a result, people began to stock up in the case of a complete shutdown, and many food and personal item storages trickled in. This made people go into more panic as those that weren't stocking up and buying their usual consumption weren't able to purchase their share of items. Supply and demand was really affected by the level of restrictions stay-at-home orders were, and still being in a pandemic, it can still be reflective of the current status we're at as a country. With the mask mandate, there were a bunch of questions from the public in regards to the type of masks one should be wearing, whether that be a medical mask, cloth mask, or an N95, as well as questions to their efficiency. In correlation to this, there were a number of people that voiced their opinion on the mask mandate being an infringement of their rights. Despite the effort of using masks as a protective measure, it soon became a political issue that even stemmed the false claims that masks weren't effective of protecting us from the virus and that COVID-19 was fake.
So the things that I've collected, that I've gathered was from the Iraq and as well Kurdistan region, was about there were a lot of one things where the people will learn about was having their difficulties during the pandemics, and as well how they work on initiative and specialized technologies that helping to understand and identify the impact of COVID-19 on around the world. And there is an opportunity for us to build a new technology with a wide range of applications. For example, when we build sensors in smart cities, it won't just to be about detecting carbons and emissions, but about using the same technology to detect viruses, chemicals, and anything else that may harm health. And this is an area of overlap where there is having this type of problems that we will face in the country and specifically in the Iraq. So this is our some close students, there are times that during the COVID-19 and their behaving, and as well the mass factory employees for there are some reasons as well. Vaccines were developed rapidly, as we all know. First, the production starts before the end of phase three clinical trials. The second was about a lot of different in volunteering or the trials that they tested vaccines of the effectiveness, which were very dangerous in our country and in our city. And there were a lot of disease in our community, which made it faster to see whether the vaccines were effective and as well how many millions of the people were getting injured.
Similarities that all four countries shared is their action during the pandemic of limiting the number of people in certain areas and spaces. Another similarity is the measures placed in having consequences for those that didn't wear their masks, whether this be through fines or declining service/entry. In both Morocco and the US, its citizens were worried that the income flow during the stay-at-home order. In response to this, those that were self-employed in Morocco received monthly compensation, and those with workers' insurance were able to reap their benefits. In the US, workers were able to apply for unemployment, and a number of stimulus checks and credit were given to those affected financially from the pandemic. A couple of differences between our countries were the set measures of keeping people at home. For Morocco and the US, there were curfews in place and updated throughout the height of the stay-at-home order, and for Chile, its citizens were allowed to be out certain days of the week. In doing research on the mask mandates, it would also appear that the US has been quick to lessen the mask mandates, despite the recommendations of keeping it in place. Morocco, Chile, and Iraq, on the other hand, have been reluctant to reduce its mask mandates this quickly and are listening to professionals in order to prevent the greatest health risk in the spread of COVID-19.